Welcome everyone to STI's presentation on MIPS, Achieving the ACI Objectives and Measures. My name is Karen and I will be your presenter today. The ACI information category promotes patient engagement and electronic exchange through the use of certified EHR technology. Many clinicians may be familiar with the components of the ACI category because it is very similar to the former Medicare EHR Incentive Program known as Meaningful Use. This webinar will provide you with the information on the ACI requirements for 2017, how to achieve the measures and objectives, and how they are scored. For this year, the ACI category is worth 25% of your composite score. It's made up of the 4 base scored measures, 7 performance scored measures, and there are bonus points available. You must report for a minimum of 90 continuous days, and the goal is to achieve 100 points to receive full credit or 25 points towards your composite score. There are 3 performance options for this year. One is the test pace option, in which you can submit information on all 4 base scored measures to avoid 2019 negative payment adjustments. You can report as an individual or as a group, and the individual provider will be identified using the combination of their billing TIN and NPI. And the group, which is 2 or more eligible clinicians, will be identified by their NPI who have reassigned their billing rights to a single TIN. You must use the same identifier for all MIPS performance categories. And for the group practice, you can elect to submit your providers as individuals or consolidate your data and report as a group. There are several data submission mechanisms that you can choose from to submit your ACI data through, but you can only select one to do so. It does not need to be the same mechanism that you chose to submit your quality data through or your CPIA data through. There are some MIPS eligible clinicians that will have their ACI category reweighted to 0. CMS will automatically do this if you are considered a hospital-based clinician, non-patient facing physician, nurse practitioner, physician assistant, a certified registered nurse anesthetist, or a clinical nurse specialist. It is optional for these clinicians to report on the ACI measures, and if you do, you will be scored just like any other MIPS eligible clinician. Hospital base is defined as providing 75% or more of Medicare services that were performed in an inpatient or outpatient or emergency department. And those place of service codes are 21, 22, and 23. The non-patient facing clinician for an individual is defined as 100 or less patient-facing encounters. And for the group that provides 75% or more of their NPI's billing under the group's TIN that met the definition for the individual non-patient facing clinician. Note that telehealth services are considered as patient-facing encounters. A clinician can apply to have their ACI performance score reweighted to 0 for the following reasons. 1, if they have insufficient internet connectivity or they experience any extreme or uncontrollable circumstance. And the third is if they lack control over the availability of their certified EHR technology. If the ACI category is reweighted to 0, the category's weight of 25% would then be added to your quality performance category, making it a total of 85% towards your composite score. We're going to begin with the base scored measures, which will earn you a total of 50 points. These measures are protect patient health information, electronic prescribing, provide patient access, and health information exchange. Note that failure to perform a security risk analysis will yield 0 points for the ACI category. You must have at least 1 in the numerator for e-prescribing, provide patient access, and health information exchange. You must also complete all 4 measures to receive the full 50 points. You cannot receive partial points for completing just some of the measures. Starting with protect patient health information. Again, to meet this measure, an eligible clinician must attest yes to conducting or reviewing a security risk analysis and implementing security updates as necessary and correcting identified security deficiencies within your reporting period. Conducting a risk assessment can be a challenging task, and the ONC collaborated with the Department of Health and Human Service, Office for Civil Rights, and the General Counsel to develop a downloadable risk tool to help you guide you through the process. If you go to www.healthit.gov, Providers, Professionals, Security Risk Assessment Tool, you can click on the SRA tool on the home page. You will need to create a new account and then log in to begin answering the questions. Please note that it does date and timestamp each question you complete, and it's very important that those dates fall within your reporting period dates. Our next measure is electronic prescribing. So at least 1 permissible prescription written by the clinician is queried for a drug formulary and is sent electronically during your performance period. ChartMaker's drug formulary functionality is already turned on. To electronically prescribe a medication, you would want to be in an office visit note and click on the medication button. You can either renew medications or add a new or prescribe a new medication. You will want to certainly fill in all appropriate fields and then click Next. In the confirmation box, you will have the option to select your location if you have more than 1 practice location, and to select the patient's pharmacy. If the patient only has 1 on file, it will default to that pharmacy. When you're done, click Confirm and Send. An alternative method is that you can add new or renew medications off of the patient's face sheet. And again, as long as the transmission has been set to send it electronically, you will receive credit for this measure. These are the written instructions for slide 10 and 11 that I just reviewed. And please note that if sending controlled substances electronically is permissible in your area for your state, you would have an indent trust token. Just a reminder, that must be inserted into your computer before you click Confirm and Send, and you also must enter the earliest fill date field. Next is measure provide patient access. This measure falls under both the base scored measures and is one of the performance scored measures, but you only need to have 1 in the numerator to satisfy the base score. The denominator is defined as the number of unique patients seen by the MIPS eligible clinician during the performance period. Unique patient means that the patient will only count once for the measure within your reporting period. To complete the measure, you must provide the patient or the patient's authorized representative timely access to their health information. You will need to enroll in the patient portal to meet this measure, as well as other measures in the ACI category. You can log on to STI's website, click on Enrollments, then Patient Portal to access the Patient Portal enrollment. Once you have submitted your enrollment, an STI representative will contact you to configure your system and provide you with 2 training sessions. The fee for this service is $29 per month per provider, or $15 per month if you are a physician assistant or nurse practitioner. To enroll the patient for the patient portal, you can do so if the patient has an email or not. Log into the patient's account in Practice Manager and then click on the Patient Portal button under the Patient tab. The first authorized button is if your patient has an email address, and the bottom authorized button is if the patient does not have an email address. And of course, if they don't, you would want to give them printed instructions and encourage them to complete the registration at a later time. Once you have selected the appropriate authorized button, click OK, and then click Yes. That patient portal button will now show as yellow, indicating a pending registration, and the button will turn green once the patient completes the registration process. Go ahead and click Save to close the patient's account. Now the denominator will be counted when the provider completes and signs an office visit note with a valid CPT code. And the numerator is then calculated when the authorization is sent within 4 business days of that office visit note. These are the written instructions for slide 15 that I just covered. This is the last of the base scored measures, which is Health Information Exchange. This measure is also considered under the performance scored measures, but again, you only need one in the numerator to satisfy it as a base scored measure. This measure is when you refer your patient to another care setting or provider. There are 2 steps. You must create a transition of care summary, and you must send it electronically. To achieve both steps, you need to do so through direct messaging. You want to open the patient's chart in Clinical, click on To Do, Direct Messaging, Send New Message, and then click on the To button. Enter the last name of the provider, their city and state that you are sending the document to, and then click Search. Click on the provider in the search results window to highlight it, and then click To, and then OK. You must enter a subject in the subject field. Next, you will click Generate and attach the CDA. It defaults to Transition of Care Summary and the document to be exported. You would then choose a provider from your practice if there's more than one in the Provider Selection dropdown and click Save. You will check items, if appropriate, in the Document Exclusion window to suppress them from showing on your document. Of course, this is optional, but you want to click OK. On the Export box, click the OK button, then select the provider who is sending the document Again, if you have more than one, but if it's a single provider, it will automatically default in that From window. And finally, click Send. You can certainly document within the chart note who you are referring the patient to. That will just note it in the note itself, but it will not yield you credit for this measure. Using the referral button will only count towards the denominator, but you will not get credit for generating a transition of care or sending it. You must complete the steps that I just reviewed. And these are the written instructions for slide 18 through 20 and for slide 21. Moving on to the performance scored measures. You can earn up to 90 points for these performance scored measures, which are health information exchange, immunization registry reporting, medication reconciliation, patient education, provide patient access, secure messaging, and view, download, and transmit. You will want to select the measures that best fit your practice, so you do not have to complete all 7 measures. Again, you must earn the full base score credit in order to earn any score under these performance scored measures. Health information exchange and provide patient access are the two that overlap as a base score measure and a performance score measure. For them to count under the base score, you only need 1 in the numerator. But to obtain additional points as a performance scored measure, you will want to have a much higher numerator count to yield more points. The percentages indicate the total of percentage points for each. For immunization registry reporting, if you can attest yes, you will earn the full 10 points. All other measures will be calculated by dividing the numerator by the denominator and then timesing it by 10. That sum is then referenced to the performance rate, and the percentages there indicate the number of points. However, there are 2 measures that are worth 20%, so you would want to double it since this chart is indicating the measures that are worth up to 10%. So for example, provide patient access is a measure that you can earn up to 20% or 20 points for. If your numerator and denominator is 62 over 95, that would equal 0.65. Times that by 100. That would give you 65, which falls within the performance rate that would equal 7 points if it was a 10% scored measure. However, it is worth 20. So you'd want to double that, and you would then earn 14 points. So we're going to begin with immunization registry reporting. The clinician must be in an active engagement with a public health agency submitting their immunization data to report yes to earn the full 10 points. Providers who administer any immunizations must register with a public health agency to submit their data. If you need to sign up, you can go to STI's website, click on Enrollment, Immunizations. Note that we provide a list of registries that are available per state, and once you select a registry that would be applicable to you, you would need to call STI to begin the enrollment. There is no cost for this service, and STI will provide the setup and training. And here are the written instructions covering slide 26. Next is medication reconciliation. This is when you perform a medication reconciliation for patients that have been referred to you or they are a new patient to your practice. You will need to review their medications, allergies, and current problem list. To perform a medication reconciliation, you will need to be in the patient's chart note and click on the medication reconciliation button. Select yes to the appropriate method of referral and or if the patient is a new patient, and then click yes that the medication reconciliation was performed, and then click OK. Within the same note, you must enter an appropriate CPT code for that office visit in order for you to get credit for this measure. Now, there is an alternative method in which a procedural checklist has been set up that contains the appropriate F codes showing the action of medication reconciliation. This method will still work. However, we do recommend that you switch your template out and place the medication reconciliation button within it. This is a very simple template editing process, but if you need some help, please feel free to call STI's Clinical Support Department, and they would be very happy to switch it out and place that medication reconciliation within your template note. And these are the written instructions covering slide 29. Our next measure is patient education. It is the number of unique patients seen during your performance period that you provided them with a printed document of clinically relevant information. In a patient's note, you will have the option to select from a predefined list or from information found on Medline Plus. Now, to add educational material into your database to configure that predefined list, you want to go to Edit, System Tables, Educational Materials, and then click Add. Type the description of the educational resource, and of course you would repeat that process if you have more than one resource to add to your list, and then click OK when you're done. To document that educational material was provided to your patient, you need to be in an office visit note and click on the Educational Materials button. Select from either the predefined list that you created or from the Medline Plus icon. You can either search by selecting one of the patient's diagnosis or medication or labs that will appear in the top boxes, or by typing a subject matter you are looking for into the search box and then clicking Go. After selecting the appropriate item, you want to click Save and Print in order to get credit for the measure. Click OK to close the Educational Material dialog box and enter an appropriate CPT code within the note. And these are the step-by-step instructions covering slides 32 and 33. Our next message is secure electronic messaging. This is where you are sending a secure message to your patient, or you are replying to a message that was sent to you by your patient. The secure message sent and the office visit must occur within the same performance period in order for you to get credit for this measure. And again, it is defined as a unique patient, so it will only count once during your reporting period. To send the patient a new secured message, you want to open up the patient's chart in Clinical and then click on To Do, and then click New Patient Portal Message. Enter the subject matter and your message, and we do recommend that you save it as a chart note. finally click Send. Now, to reply to a message that was sent from the patient, you would want to double-click on that patient portal message from your to-do list and then click Reply. Type in your reply message in the top window, and again, we do recommend that you save it as a chart note. If you are saving it as a chart note, you can certainly change the heading of the note and then click OK and Send. And here are the written instructions covering slide 36 and 37. Our last measure is View, Download, and Transmit. It is the number of unique patients seen during your performance period who viewed, downloaded, or transmitted their health information. Once you have sent a patient portal invitation to the patient, remember that was carried out through Provide Patient Access measure, the patient will need to register so they can have access to their health information. Now, the provider must submit health information to the patient's portal, and once registration is verified, ChartMaker will automatically send updates at pre-configured times. Clinical summaries and electronic labs will automatically upload to the patient's portal upon signing, and scanned documents can also be uploaded. When you open the patient's chart and open that document, right-click on the document and then choose Send to Patient Portal. Once you have authorized your patient, encouraging them to register for the patient portal, they will receive an email if they did have an email address at the time that you authorized them. They would click on the link to access the patient portal to complete their registration. They will need to fill out the required information, such as their username, their date of birth. They will set their password and then re-enter it to confirm it, and select the security question and certainly provide the answer to that. They need to accept the terms of use along with typing the security characters that are displayed within the picture, and then click Register. They can then log in using the credentials that they set up to do one of the following. They can either view clinical summaries or labs. They can certainly download their information, or they can transmit it to a third party if they choose. So again, you have to send an authorized invitation to the patient. They need to complete the registration process, and information must be uploaded to the portal, and all this must occur within their your performance period for you to get credit. And this is a slide providing you with the written instructions covering slide 41. Moving on to the bonus points. So again, you must satisfy all the base scored measures in order to receive bonus points. You can receive 5 bonus points for public health reporting, whether or not you report through a specialized registry or a registry that supports syndromic surveillance. I'm not going to spend a lot of time on syndromic surveillance since at this time we don't have any agencies accepting such data, but my focus is going to be on this specialized registry reporting. So again, if you're in an active engagement, you can report yes to this and receive 5 bonus points. Now, with meaningful use, this was a required measure, and therefore STI partnered with the Genesis Registry provided by CE City. We are still partnered, and we do offer this service to our clients. However, for MIPS, this is optional. It will only yield you 5 bonus points. So if you continue utilizing the service, of CE City, you will gain those 5 bonus points provided you carried out all the base scored measures. If you choose to enroll with CE City, you can do so by going to STI's website, click on Enrollments, MIPS, and then click on the CE City Enrollment. The service does cost $399 per provider per calendar year. You can also earn 10 bonus points for one of the CPIAs that are listed here. Again, the reporting would be yes. These practice activities actually rely on certified technology to support the activity. So, for example, provide 24/7 access to the eligible clinician or group who have the real-time access to patient's medical record. Providing the patient access to their health information and secure messaging. These measures actually support this activity measure, and if you can attest yes to one of these, you will receive 10 points. Now, if you're familiar with the CPIA performance category, these measures are weighted as high or medium. For the bonus points under the CIA category, you do not need to be concerned selecting a high or medium weighted activity. Any one of the 18 would yield you 10 bonus points, and that would be the maximum number of points you can receive. So how is your overall ACI scored tallied up? Well, you take the 50 points for the base scored measures, any points you received for the performance scored measures, and add in any bonus points. That gives you your total number of points. Note you will be capped at 100 points. The total points is then divided by the total possible points, which is 100. That sum is times by the category weight, which is 25%. That sum is then times by 100, which will give you your total ACI score. Just to remind everyone that STI is offering a MIPS assistance program. Enrolling in the program, you would be assigned one of our MIPS coaches who will help you choose and recommend measures in all 3 of the performance categories. They will certainly set up your system and train you how to achieve those measures and activities. You will also have access to our quality register portal in which you can then submit the quality measure data through. Your coach will certainly get you familiar with the portal's functionality, show you how to review your data that you are submitting. They will be providing you with touch-base calls throughout the year and certainly monitoring your progress. And when it comes time to submitting that data, they will be on hand to assist you with that task as well. The cost of our MIPS assistance program is $3,750 for the first provider in the practice and $1,875 for each additional provider. You can gain more information by going to STI's website, clicking on MIPS and then Enrollments. We do have a PowerPoint presentation that gets into much more detail about the program. We are offering a quality registry, and you do not need to be enrolled in our MIPS assistance program to have access to that service. The cost of our quality registry is $590 per provider per year, but again, it is free for those who are enrolled in our MIPS assistance program. If you have additional questions regarding MIPS, you can certainly reach out to CMS Quality Payment Program Service Center by giving them a call, or you can send your questions through email at qpp@cms.hhs.gov. And that concludes our webinar. Thank you for your attendance.